This is Lab 11, Exercise 5. So in your lab manual binder, you see the instructions are simply to follow the instructions from your lab textbook. So Lab 11 is about obtaining refill authorization. The objectives for this lab are to learn strategies for resolving problems associated with expired prescriptions, demonstrate proficiency in using pharmacy management software for prescription refill authorization, practice securing authorization for prescription refills via paper forms, and learn protocols for communicating refill authorizations through simulated phone conversations with the prescriber. So you're going to read through your lab textbook, which gives an introduction to obtaining a refill authorization. You want to think about, some of the soft skills that you have, good communication skills. You're going to have to talk to physicians' offices in requesting a refill, things like that. How to talk to your patient, especially when they're upset, if they can't get their medication right away and you're waiting on a refill request, and what that could entail for them. Oops. So patients sometimes request a refill that on a medication that's either expired, they brought the original prescription in more than a year ago, or maybe they didn't, maybe they waited, but it was dated more than a year ago, or maybe the prescription doesn't have any refills. When that happens, the pharmacy has to contact the prescriber. Generally, we can call the doctor's office, or some doctor's offices prefer to get a fax copy, and then they can handle all of them at one point in their day. The prescriber will either authorize more refills or deny the request. Sometimes the denial will come back and say that the patient needs to call the doctor. Maybe they need some lab testing done before the doctor gives them a refill, or the patient hasn't followed up with their physician on something else, and it's kind of their way to force the patient to go see them. Sometimes the doctors will approve maybe just a couple days supply, so that like a blood pressure medication, they don't want the patient to go without, but the patient needs to go in and see the doctor. In Louisiana, we are allowed to contact the prescriber for that authorization. However, in some states, technicians are not allowed to do that. Only the pharmacist can do that. So government regulations of refills, basically the state laws can vary. So they can be more restrictive than the federal. Basically, Louisiana is as general as the federal guidelines. We want to memorize the laws to our state, which allows refills. State laws cannot be less stringent than the federal law. So they can't just say anybody can get a refill no matter what. So substances controlled on Schedule 2 can never be refilled. They always require a new prescription, except in emergency situations, which must be handled by the pharmacist. Substances controlled on Schedules 3 and 4 may have up to 5 refills within 6 months. Now in the state of Louisiana, that includes Schedule 5 drugs as well. Non-controlled prescriptions, and in some states, controlled prescriptions that are Schedule 5 have no limitation on refills and can be noted as PRN, provided the prescription is not more than 365 days old, has not expired. The prescriber can choose up to prohibit refills or stipulate a maximum number of refills for both controlled and non-controlled medications. Just because the law says they can have up to a certain amount does not mean that the prescriber has to give them that amount. So let's review the refill process. So we're going to generate a refill authorization request using our software. The information is then phoned in, faxed in, or electronically submitted to the prescriber for authorization. Some prescribers will require that requests be faxed so that they can have a hard copy of that request to put in the patient's file. Prescribers' offices may deny or approve refill requests. It is a prescriber's prerogative to make that professional judgment. The prescriber may communicate special instructions for the patient. Like I said, they may say that the patient has to go in and see them. If the refill request is denied, the technician will note the decision and then notify the patient. If the prescriber approves the request, the technician can generate a new prescription. It's sometimes called a renewal of a prescription. So then we come to the procedural component of the lab. And we can see how to generate through that. I'm not going to bring up the tutorial. You can work through your tutorial. When that refill request comes up, now I do want to note that the prescriptions that you will be requesting refills for are located on page 142, or start on page 142 in your lab textbook. One of the other components when you get through to the print screen, and you click print for the refill authorization, this should generate to the printer. You will not have to save as a PDF and then print. So you're going to go through the steps and follow through. Now for the tutorial, it will not print the refill authorization, but for your other patients, you will click the print call physician form and OK, and then it will send it through to the printer. Now, once you've completed that component of the lab, you will then have to gather all of your requests, and your lab instructor will provide you with information on how to proceed with phoning in the refill request. So in this part, you're going to either phone or fax in, and then the instructor will authorize or not a refill. So be prepared with all the necessary information if you're making a phone call. It's all on the refill request form. You might talk to a person, or you might leave a message on an automated machine. Refill requests are frequently communicated through telephone, so you're going to follow the procedures as outlined in steps 13 through 18 of your lab textbook. Which of the following types of prescriptions can never be refilled? I think by now y'all know that answer. C2s. What is the proper way to submit a refill request? That would be any of the above, unless the prescriber has authorized you a different way to do that. So when phoning in those refill requests, so this is the steps 10 through 11, or 10 through 17, 18, anyways. How do we do that? So like I said, your lab instructor may pair you off. They may have you fax some in, different routes, so they may just select a few out of the group. One of you is going to play the technician, and the other acts as the agent from the doctor's office. If you deny the request, you must offer justification for the denial. If you approve, state how many additional refills are allowed. So to telephone the prescriber's office, when the phone's answered, you tell the person answering the phone who you are. So generally, I would say, if it was me, this is Ann Levance. I'm calling from Delgado Pharmacy. I'm calling to request a refill authorization on patient Cass Riley, for example. They will either transfer you, or they will be able to take the request. If you get a recorded message, listen to it to decide what's the appropriate steps. So when speaking to a person, or especially on a message line, you want to make sure that you're speaking clearly and that you give the following information, and it should be in an orderly manner. So it's very similar to the way the original prescription is laid out. You want to say the patient's last name, not only say it, but spell it out. Also the patient's first name, their date of birth, because again, you know, they might have multiple patients by the same name. The medication, say it and spell it, because sound alike, look like drugs. The strength of the medication, the quantity that's been requested, the instructions or the SIG, date written, the last date refilled or dispensed, the prescriber's name. There may be more than one doctor in the office. Your name, the name of the pharmacy you're with, and most important, a callback number. So I often start with the beginning, but then you also reiterate that later on. If you're on a message system, state the information again. If you're speaking to a person, repeat the information in the same order. And ask the person to repeat it back to you just to make sure that the information matches. So the authorization may be immediate, or it can take up to 48 hours. Part of that is to be safe. They want to go pull the patient's file, look up the request, identify, is it appropriate? So, some days the doctors aren't actually in the office. They're doing a call either at a hospital or something like that. So if we call on a Tuesday afternoon and the doctor does office hours or calls on Wednesday at the hospital or has surgery or something like that, they may not get back to us until Thursday. So it can be up to 48 hours. So it's important to let your patients know that as well, so that they're not kind of getting upset. Why is my prescription not ready? Why is it taking so long? We want to make sure that they have all of their information. Take special care when filling in the number of additional refills, because that number refers to the refills authorized to take place after the current one. For example, if the prescriber authorized only one refill, you put a 0 in the blank because you're about to give them that one additional refill. So if they say 3, the one we're filling, it will give them an additional 2 more. So you would put 2. It's a little confusing on that, but that's an important point to make. Now, if the authorization is denied, it's important to write that on the form, but we also need to let the patient know. If the authorization is granted, we want to put temporarily approved refill authorization request form aside, and we'll process the remaining requests, and then we'll go on to the next part in the lab. Once you've gotten all of your requests completed, then you'll go on to step 3. So again, this is a point in the lab where the instructor may give you an additional responsibility of actually filling the prescriptions. But all of you can come back together and talk. How do the roles of pharmacists and technicians differ in the process? What are the limitations and opportunities for growth or evolving roles? Discuss the essential skills for obtaining refill authorization. What does it mean to act professionally? What are the rules for telephone etiquette? What other communication skills might you use to professionally and successfully obtain refill authorization? And discuss state-by-state variation and regulations of the pharmacy technician role. What regulations does your state's Pharmacy Act impose on job activity? Do you even know where to find that information? So I'm going to tell you where to find that information. Okay, so under Title 46, Chapter 25, Prescriptions, Drugs, and Devices. So if we're looking at that from here, we're going to go to Chapter 25, Prescription, Drugs, and Devices. So this will give all of the information, returning, investigational, veterinary, devices, information on prescriptions. So oral, electronics, receipt verification, electronic, dispensing, and prescription refills. So in the state of Louisiana, refill authorization, prescription refills may be dispensed only with the prescriber's authorization as indicated on the original prescription order. In the absence of the authorized practitioner's instructions on the original prescription, the prescription shall be considered non-refillable. When all refills authorized on the original prescription have been dispensed, then authorization from the prescribing practitioner shall be obtained prior to dispensing. When such authorization has been received, a new prescription shall be prepared and it shall be issued a different prescription number. So technically in Louisiana, we don't do a refill request. We do a renewal or a new prescription request. So that's the state law as far as prescriptions go. So in summary, Expired prescriptions and prescriptions with no refills require authorization from prescribers. We use the software to generate a request form and then fax it to the or call it into the prescriber. There is a specific protocol for making those authorization requests, and in some states, technicians are not allowed to request that. Again, in the state of Louisiana, we can call in for a renewal of the prescription. All right, so this is exercise 5, lab 11. You will process prescription requests, and then you will go on to lab 8, or I'm sorry, lab 12.